Hello, hello everyone. It's a real pleasure to join the SF family, the SF 24 hours round the clock across the globe. We move. Uh, Really, congrats to the entire team behind this initiative. It's a great one. Hopefully, globally, the everyone, right? Not only therapists and those who work in mental health, but everyone, the education, every sector would move towards identifying solutions. With that, we also thank the organizers for giving us the opportunity to share our views and the kind of small work that we do in India. It's a part of a research initiative, but we'll be sharing our experience not exclusively in research, but in the school and college based activities that we do. The focus of today's presentation is on our initiatives in relation to improving well being and preventing suicides among school and college students. Myself, Indu, I am a psychiatrist. I also work in public health. Currently, I'm the principal of Government Medical College Thrissur, Kerala University of Health Sciences in India. And with me is Dr. Anil.
I'm Professor of Psychiatry, currently head of the Department of Psychiatry in Kochi, Kerala Medical College, the teaching institute. And I'm mainly practicing child psychiatry and community mental health.
We welcome you to visit India and to visit our settings as well. Shall we share the slides? Thank you all for joining. We would like to make it an interactive workshop, so we'll stop in between. Even otherwise, please raise your hand so that we can have a discussion. Shall we start off with a self introduction and the kind of work that we do, each one of us do? Yeah. Mm.
Now we can see your screen in a minute. And now we see the first slide.
Yeah.
Yeah.
Is it moving?
Yes,
Yeah, it's
fine, perfect.
So, good morning and good afternoon, and thank you. So, being an interactive workshop, let us start with a question. Can you identify the change from this first picture to the second picture? This is taken from my duty room. What's the time gap? Can you guess the time gap between these two photographs from the same window?
It's a photograph from the his clinic's window. Hospital.
I'm thinking the first one is sunset. No?
It's a morning. Yeah, morning.
Both of them.
3 weeks.
3 weeks. When we usually use these pictures in this solution focused training, suicide prevention, well-being training. So people usually say 3 months, 6 months, and all. Actually, one answer was actually only 1 week. 1 week. So we introduce like this. What we focus on grows, whether it is problem or solutions. So students are already capable of change. Our job is to help them to recognize it, their resources, and motivate them to change, rather than giving advice, counseling, and make them change. So we use these sort of pictures of flowers, birds, and nature to introduce the concept of solution focused, that positive.
The outline of our presentation is from the National Health Research Priority Project, Suicide Among Youth. It is Indian Council of Medical Research, the Department of Health Research Priority Project, which has 4 action points. We'll come to that. And we are trying to introduce solution-focused approach into each one of the interventions. How it evolves, we'll discuss. and the magic of solution-focused approach, which each one of us are really aware of, the frames. It's only an acronym. And in safety assessment, in the kind of suicide prevention intervention, how we bring in the solution-focused approach in safety assessment using the steps of solution-focused approach that we usually used in SFBT. And finally, well-being through safe nest. Here also we introduced a solution-focused approach. We have been trained by Dr. Arnold Huber. He is again coming back to India in
next week,
February 16th and 17th in Trivandrum, Kerala. He's conducting a workshop this time on.
Last time also he was here. So we continuously interacting and learning from him and all the senior people in the field. So this is for last 6 to 8 years. We are using solution-focused approach in our daily clinical practice, community, and even in research. So it is giving a lot of satisfaction and confidence to move with the solution-focused techniques in this interaction with youth, teachers, and policymakers, even with the policymakers.
This is the multi-state implementation research study on suicide risk reduction and improving mental well-being among school and college students. This was based on an interest call at the all India level, and ours is one of the 8 sites which have been selected on a national basis. You can see here Trivandrum and Kollam, Kerala. I was the principal investigator. After I moved out, Dr. Chinda is now the principal investigator. The 4 interventions. This is the national framework for suicide prevention. One is leader engagement. If all the leaders at the state level, district level, different departments. So leader engagement is one. Second is gatekeeper training, which is the content. That content is based on suicide prevention. Third is the youth engagement, which includes peer mentoring. We encourage all college and school students, especially those who are into schemes like the National Service Scheme, who can be trained as peer mentors. And lastly, the self-help interventions for the youth. We try to incorporate the frames. We'll come to the expansion, the future-oriented questions, which is setting the goals, resource activating, the miracle questions, exceptions, and scaling up into each one of these interventions in leader engagement, gatekeeper training, youth engagement, and self-help interventions for the youth. The last part is well-being. So this is the general framework. Everyone needs well-being. So when we say suicide prevention, we are not directly targeting suicides. We try to work with the well-being, the steps and interventions to improve well-being of school and college students. And in the process, which is, of course, through the education department. And since we work in medical schools, we work with the Directorate of Medical Education. We are also targeting students in medical colleges, both medical, nursing, dental, paramedical, engineering, law, both arts and science and professional colleges. And health, as we have discussed, everyone requires that well-being intervention for primary prevention. And this is the can discuss the National Service Scheme, the Parent Teacher Association, the health university, the teachers, etc. And secondary prevention is identifying those who are at high risk. And that is basically through training teachers and the peer groups and parents. And finally, giving interventions for those 5% who really require targeted interventions. The leader engagement, gatekeeper training, peer interventions, and the self. And because to generate, the interventions, we had the qualitative measures, in-depth interventions, in-depth interviews, and focus group discussions. So conventionally in research, we do the in-depth interview as a qualitative tool, but within that, we use the solution-focused approach. So to develop the program, we ask the questions. Usually in all these in-depth interviews, the interviews usually come out with the problems, and they usually revolve around the problems, and problems. But then we use the solution-focused format to generate suggestions during the in-depth interview. That was the peculiarity of this research. And as we go ahead, this being an implementation research, the actual work happens, and we start off with something called a model zero. And based on the inputs during the implementation, changes come up in the way we implement. That is how both at the micro and meso levels changes happen. The steps, this is just theory. The steps in co-designing, which is part of the research, or we can continue.
Yeah, this co-designing means we are designing the intervention with the help of the local leaders, stakeholders, what is feasible in that specific school or campus in that local area, depending on their priorities and the feasibility. So these are the scaling questions we use in solution focus. So depending on that, we can select and implement that. And what are the action needed? Again, looking for resources. So the implementation theory part incorporated with the solution gives more edge or more robust inputs for generating local solutions which can be implemented. So that is the beauty of this implementation research, which is we can give modifications suitable for the local area, local panchayat or local county, something like that. And there is a grid for using what is the impact, what is the feasibility score, what are the action needed, who are all responsible for that, and role of the health system, education system, and how research team will facilitate. So the initial qualitative phase, formative phase, and base after 6 months, we develop this action plan and implemented in. Currently, that implementation is going on in 62 schools. So, any question at this point of time so that we can be interactive and move forward? So, the solution, this was actually we presented previously also the major concepts of solution focused theory. We summarized into the concept of frames. That's an acronym used to train them. So these are the examples we usually use. You must be familiar with that. Student with a problem. Usual training is to diagnose and treat. But here it is strength, and we have to discover the resources and build on that, like that. And for example, a student, these are the examples we use when we discuss with the students and teachers in the schools and colleges. There is a problem when we suicide attempt. Usually ask why that problem, or why this suicide attempt. Instead of that, we have to modify that. Last time, how did you manage this such similar situation, stressful situation? What helped you, like that? So, and we also bring that model of the brain and give that biological connotation to our work, talking positive things that will change that stress will stimulate amygdala, and the solution talk will stimulate open your frontal lobe, endorphins, and you will be in a happy mood to find out the solution. So the success promote more changes. So, this way it is appealing to the students and other stakeholders when we talk and give some objective brain as a biological uh, substrate for mind, and it is possible to make changes in the brain through using positive words and solution focused approach. So this is I think we have taken from that O'Connell's book, Solution Island and Problem Island. So we have to spend 20% of the time for problems, but majority of the time we have to explore what are the resources available, what are the solutions available. So these sort of pictorial depiction help the audience to understand importance of looking for positive solutions rather than always discussing about suicide and problems. And we use this acronym frames. Almost all the theoretical concepts are summarized in that. So these are the pictures we use. Use a frame with a new glass looking to a better future. So that summary is F is for future. We discuss what do you want to change, future oriented question. R is for resource activating questions. M is for miracle questions. E for exceptions, that is success stories. How did you do that? Like that, scaling questions. So these are you must be familiar with that. So this acronym and using the different objects to explain and group work based on that acronym will help in a short period of time. We will be able to communicate basic principles of solution focused therapy. So these are the questions, future oriented. What difference you want to see in life? What are the resources available? If everything is solved, miracle question. So what will be changed and exception finding like that. So the scaling question, where do you stand now? What is the confidence? How to improve that? And so the major theoretical aspects are covered in this, and we use this model of frame. So the two glasses. So this usually give us a group work. So one circle you have to write what are the future changes you want. The other glass you have to write what are the resources available, what are the strengths, what are the support, and then you have to more focus on miracle. If everything is, if the problem is over, so what change it will happen? And here also, what are the success stories? And so in a single page, we give a printout, and in a group work, we ask them to work on each of these questions and present depending on their own thoughts, and then present in the major group, and we interact with them to give that idea of solution focus thought process, how to change that problem oriented thinking process to a solution focused thinking. These are some examples in which teachers are trained in that group activity. You can see that, let me try this video in which teachers are presenting. This is in Malayalam. They are speaking in our local language, Malayalam. In the first circle, they are
We don't hear
talking
the
about
voice. Should we hear the voice of the video now?
This is in Malayalam. You need not bother about it.
Okay.
Video is playing. Is it visible?
Yeah, we
Video
can
is
see
playing.
it. Thank you.
Only thing is the message is in the first circle, they write what are the goals, what are the changes they want to change, even in the school system to improve well-being of the children, and what are the resources available in the school, and what are the things we have to improve, like that. So the teachers will come out with suggestions to improve the school setting, and what are the things should be done by the management, higher authorities, or government, and what are the local resources required. And recently we presented in the Kerala University of Health Sciences. This is a medical college, all medical colleges, you can explain.
All medical, dental, nursing, all the healthcare training institutions of the state are under this university, Kerala University of Health Sciences. So when we presented, this is their mentors in the training happening at the university. So the advantage of bringing in the solution focused approach in such trainings of mentors in the training of trainer program is that, when they go back and deal with their students, the conventional, we all know that, but then we have an acronym called NEST also coming up. So well-being itself is a abstract concept. So we are trying to boil down that into NEST. We'll come to the expansion of NEST as well, so that the teachers find themselves easier to interact with their students. This is the student support and guidance program of the Kerala University of Health Sciences. As we are aware, the medical, both undergraduate and postgraduate nursing, etc., the healthcare, those who are in the healthcare field, they feel more stress, and the suicide attempts and other anxiety, burnout, all these mental health related issues are prevalent more among these colleges which teach medicine, nursing, etc.
So these are the problems identified by the this group. reported by the students, adjustment problem, home sickness, lot of issues. Here again, substance abuse, anxiety, suicide is a major concern. So these are the areas we usually discuss, and mental health is a major component of the discussion. And these are the way in which we presented the solution-focused content. Here, the student is the expert. We are focusing on the strength. We are talking about the not of the problem, but future-oriented. Small steps are giving more importance, and the uh, techniques are miracle question, scaling question, exception finding, coping questions. Even with the difficulty, the person coming for consultation when with a severe depression. So asking about the how to ask the coping questions and compliment the child. And our teachers are always looking for. They are not specifically trained in any psychological. They are from different background, anatomy, physiology, or biochemistry.
Medicine, surgery, different specialties in medicine. So, simpler methods which can be trained, right? So that's a trend.
We offer them that even with a single session, you can make a change. So it is more of the attitude change, the way in which you ask questions. So instead of asking questions, problems, we encourage them to ask what do you want to change. So how did you manage earlier? What are their resources available in the person and initial phase it is little difficult to reframe the questions, but by through group activity it is possible to demonstrate that this is more feasible, and we tell them that it will reduce the burden and burnout of these faculty members, and it will reduce the stress upon the or responsibility of the faculty because it is a shared decision making and supporting the child to move forward or the bringing more people together. So it is a journey together rather than we advise the child or the student to change. So we give the advantages such as a time efficiency, reduce stigma, improved outcome. So instead of talking about suicide, stress, we are talking about well-being, happiness, future, their goal, and all. So this way, it is more attractive for the teachers also, more comfortable to discuss rather than directly going to suicide as a major theme of discussion. So these are the questions. Then we break into groups and give them group activity. I think with the small group, we need not
Break up.
break into. These are the same questions that frame questions. What difference you want? What the support available? So they will feel that they will in pair or in small groups they work on these questions and come out with answers. So within a 1 or 1.5 hour time, we can introduce the major concepts of solution focused intervention. Or any question at this point of time? Italian, your comments. Elena, who else is there? Chair. Okay. I think you are using in the management sector also the same principles. We, Rika. Okay. So then the specific to suicide prevention, how suicide the instead of risk assessment. Usually in medical schools and in psychiatry, we teach our postgraduates and even undergraduate students, even nursing students, how to assess the risk for repeat suicide. So in solution focused assessment, we encourage them to assess the safety assessment rather than the risk assessment. So the examine the confidence in the ability to keep oneself safe, their relationship, who are all there to support you, what are their coping strategies, reasons for leaving, best hopes for moving. So basic solution focus principles are used for assessing and improving hope instead of asking about the risk for suicide. And these are the scales. The scaling questions we can use this. Where do you stand now in terms of not attempting suicide, in terms of safety, and how can we move forward? And what do you mean by the score 6? Or when the score is going down, when at what point of time you call another person, your friend, and who are all there to help you? Keep a card. We have to write the number in which you will call if the score is going down, or what is your better score. So like that we can use different questions. So we used it as a printed format, and used in the clinic for asking for the scaling questions, specifically for suicide attempted cases, for improving that uh, confidence to manage the next, especially for children with the borderline personality, adolescent girls with repeated suicide attempt. So this is from the literature, and we translate it into Malayalam local language. And so these are the advantages of safety assessment rather than going for risk assessment. So the same frames questions can be reworded for suiting to suicide. What is there to help you? What brings you some joy? And what is the meaning of living? What are the things which help you to move forward? And what are the miracle questions? Again, same questions. And how did you cope early? So if same frame, so this is useful for that frame concept is useful for asking questions by the counselor. So instead of learning all the principles of solution focused therapy, they can just learn this acronym frame and ask relevant questions in a short period of time. Scaling questions again, which is your safe number? When will you call your friend when the number is going down? How can you improve the number? And like that. So it's a scaling question modified for a specific difficult situation faced by the student in a crisis situation. And this again for post-vention, those who attempted suicide or the family members following a breakup, the family members or parents, or if there is a completed suicide, the parents are also in a highly stressed state. So we use that post-traumatic growth, PTG, that concept. Here the first principle is no impulsive risk-taking behavior. Then again, you have to look for self-care. In that self-care process, we introduce that nest, which will follow later. There again, that solution focused content is a major component. Then activities which derive pleasure, design a new life, and accept the feelings and move forward. So this is post-traumatic growth. So the trauma is taken as a point of growth to move forward. This is one of our student after a breakup attempted suicide, and we tried this technique, and she started painting in the hospital and produced beautiful uh, acrylic paintings, and she could maybe it's also help her to move forward and recover from the problem. And there is a movie. I don't know whether it is. There is a movie. We also will just show part of it. Are you able to see that movie? It's a
Yes,
short film.
but should there be sound? Do we need to hear the sound? We can see the movie, but it has no sound. Does it matter?
You just explain now. You പറഞ്ഞാ മതി. Short film.
This is actually a short film directed by one of our junior residents in the Department of Community Medicine. It's the title is Behind the Smile, and there is a as the story evolves, there is a medical student who smiles and mixes up with all her friends and colleagues, but finally, no one asks. Whether she has a problem. So one friend finally identifies, and she actually has depression, which is severe, undergoes treatment, and she recovers. Actually, in the film side, there are two sides. One aspect is that the problem, the girl commits suicide, and second is there is a girl who repeatedly, a classmate who repeatedly, "Are you okay?" Then she notes. Then she repeatedly asks, "Are you really okay?" And there is a mask actually here. It's a symbolically that a mask of can we move it forward? Is it? I think we can stop it. Mm.
These are all medical students in our one of the government medical college. So you can see that this girl with the depression wearing a mask. So nobody is identifying her depression, and finally she's uh, saved by another girl who understands, support, and encourage her to seek help from a psychiatrist and take treatment, and she recovers. So it is ending with a positive note that it is possible to support, and there is a solution for depression, suicide attempt, and all. So with social support and adequate guidance. So that is a message behind that. We are not. It will be available. It is available online, and it's on the ICMR site also. We'll share the link also if interested. You can. So she is using different masks. Yes.
Shall we take a 2 minutes? Shall we take 2 minutes to check our own well-being index? Yeah, think about the past 2 weeks, and the score is from 0 to 5 for each. Question number 1 is, I have felt cheerful and in good spirits. If it is, all throughout 2 weeks, we have been really happy, cheerful, and in good spirit. It's 5. And then the grade, most of the time, 4, half the time, 3, less than half the time. So happiness, being happy and cheerful, that our score. And the second item is feeling calm and relaxed, where we really, relaxed. And the third, our activity, right? How physically and emotionally active we were, active and vigorous. That's the third one. Let's have a score for that. Being active, it's actually felt active and vigorous. It's our own, impression, feeling of our own activity, whether we were rigorous enough all throughout during the past 2 weeks. And fourth is, I woke up feeling fresh and rested. Our sleep over the past 2 weeks. And finally, my daily life has been filled with things that interest me, whether it be vocation, the job, the classes, seeing patients, counseling, coaching, whatever it is, right? So, uh, where our life was full of things which interested us. And as we'll get a score out of 25, and if we multiply that by 4, we get our own well-being index. We have included this, and we do include this in our training programs because it gives an interest. They may be trainers, teachers, counselors, but their own well-being is very, very important. And do we really look at our numbers? We know our blood pressure. It's 120/80. We know our cholesterol. We know our, HbA1c or fasting blood sugar. So how many of us really bother about our own well-being index? That's why. And if this is out of 25, we multiply it by 4, we get a score out of 100. If the score is below 50, we tell them that it needs to be evaluated.
One positive good thing is that instead of measuring depression, we are measuring well-being. That's a positive thing in tune with solution focus approach. So if the score is, there are studies in which showed that the score less than 30% in this WHO, it is more with depression. So they have to be definitely, they should be evaluated for possibility of depression, suicide risk. So that way, in schools and colleges, we encourage. In 2 research project, we are using this questionnaire to assess the well-being. In my medical college, all medical students are assessed. 450 students are assessed using the scale, and the analysis is going on. And in her college also, intervention and following the intervention with this NEST, the well-being score has improved. So that way, this is a useful baseline or starting point for discussion. Instead of suicide, we can start with well-being, measurement of well-being. How can we improve well-being? And those with low well-being can be improved to prevent depression and suicide.
Well-being, as we discussed earlier, is more of an abstract concept. We try to make it more, concrete. What kind of interventions are linked to our well-being during this, using this acronym? NEST. Can someone go for make a guess on the expansions of NESST nest? It's a bird's nest. Maybe Kathy has seen this earlier. Would someone like to make a guess on what are the components of our well-being? What influences our well-being? What should we do to improve our well-being? Nest. Elena, would you like to make a guess? N, what is N? What is E?
E is exercise.
Sleep?
Yes,
Sleep must be
perfect.
there.
I
Sleep
guess
must be
one-
there. Sorry.
I guess one S must be from the solution, but
Yeah.
Yes,
Good.
perfect. Yes.
what
What can be the next test? Something which is so vital for our well-being.
My guess is sleep.
Yes,
Good,
yes.
good.
Yes.
Mhm.
And
N.
E,
E for-
exercise. Yes. N,
Exercise, yeah. Oh, okay.
N. Yes, yes, yes.
Nutrition.
Kathy, yeah. Nutrition, diet, what we eat. Lastly, T is time management. So when we really go to colleges and engage with students, they are interested, right? We are talking about things which they can see, feel, and do.
We show these pictures. Can you identify the name of this picture? Is it there in your part?
Plus,
Flowers?
name of the flowers. It's rather a wild kind of
Okay.
flower, but we grow this in our garden.
In our campus, hostels also we encourage because this improve well-being, happiness. Flowers give more. And we show these pictures and the next one is single one. So the solution, most of the children, when they get isolated, depressed, and there is a high risk of suicide. So our role is getting connected, bringing them back to hope, getting connected to family, society, their friends, and even their academics. So these sort of simple visuals also give ideas regarding solutions and importance of values and connectedness, relationships, and all. So we encourage it is okay to talk mental health. We have printed cards and distribute within the students. It is okay to seek help
Became
with.
banner, right? In the project, with well-being, students' well-being project, it's okay to talk.
And this is an assessment in South India, medical students during the COVID time using that same WHO well-being scale. Only 24, nearly 25%, 1 in 4 of the percentage of the students only gave that average or satisfactory well-being. That means majority are not happy or even though they are very academically bright and come to medical profession with a lot of enthusiasm, their well-being is very low and highly stressed because of the competitive exam, competition. And all.
Right.
Okay. So this is also another story we show that a reverse story, upstreaming. So instead of focusing on therapy, suicide prevention, counselors, posting counselors, so we encourage them to focus on the upper stream to prevent children falling into problems. And this is a video. Is it visible, that video?
Yes, it is absolutely.
കാണിക്കണം.
ഉം.
കാണിക്കണം.
വേണമെന്നില്ല.
So we discuss how to encourage the systems to prevent them falling into that problem. And even they fall, how to swim. So that is life skills. So a lot of preventive work should happen in this entire school system. That's a positive well-being, life skill training. So rather than focusing only students with problems, depression or suicide attempt. So these are the uh, ways in which we engage students and administrators. So the theoretical aspect, well-being and measurement. This is another scale we use, hero wellness scale. This is also very simple, uh, another option for well-being checking. Happiness, enthusiasm, resilience, optimism. And this is a validated tool against the WHO well-being questionnaire. This is in Malayalam. We are not going to discuss this now. So nest, again, can you identify the nest, the real nest, this bird who created this nest? Is it there in your place? It's a tailor bird. It's tailor bird. This is another one. The bird is there. So this is called honey bird. So it is to take honey. So children are, so we conduct quiz programs. We give score for identifying importance of being with nature and all. So we encourage them to be in a safe nest. So then introduce what is nest. And for nutrition, E for exercise, S for sleep, then the solution focus thinking. So exercise yoga is not enough. The way in which you think or the perceived problem, that is more important. So that's why we introduce solution thinking also as the well-being approach to well-being. And the last T is for take care of some meditation, yoga, spending time with your family, spending time with your nature and hobby and all. And we created a checklist and asked the students to follow. And even for small kids, we ask them to give scoring. If we explain, you can explain the nutrition part. Of the plate.
Yeah, it's because changing the dietary habits is also important because half the plate needs to be vegetables and fruits, and then which in India it's 400 grams vegetables and 100 grams fruits. We just need 6 ounces or around 170 grams of cereals and rest proteins. So actually, a lot of calories are being taken. Actually, the cereal content is much high. So even WHO recommends 400 grams of vegetables a day. So those kinds of small interventions at diet also improves the well-being. So this is again a solution focused.
This is musical chair. Musical chair in which usually the musical chair, many students will be playing with LR. Are you familiar with the musical chair? This is very common in our
Can you say a few
place.
words about it? Because I'm not sure if we understand the same thing.
Yeah. It's suppose there are 10 students. There will be 9 chairs, and then they move around. There is a music played, and the students just move around the chairs, and then the music suddenly stops, so they'll have to sit. So there will be since there is one chair less, one student will have to move out. But in this one, that is how it happens. And finally, one chair is taken out, removed, and they continue the play. Lastly, there will be 2 students and 1 chair, and the person who is able to sit in the when the music stops last will win. So that is usual, the conventional musical chair. So in the solution focus, we introduced what is reverse.
Start with one single chair.
Actually, in conventional, this student will have to go. The one in the green dress will have to go. But here, what happens is, Anil is asking Amrita, her name is Amrita, to invite one of her friends and then add a chair. So there's one more chair. So she comes. So
we discussed there are solutions, there are friends to help you. So all of us will win rather than going out of the game. So finally, all of us can join together and be happy. And the success is there if you work together. So that is a message. So these are the simple induction games we used in this sort of work.
To introduce that solution approach. So at a stressful point when you have to move out of the game, since there's no chair, right? There's all of a sudden, you have a friend coming up. So that way.
So these are the helpline, national helpline for stress management and even suicide helpline available. So this is locally also available. And for medical students, Indian Medical Association, there is a 24-hour helpline is available. So we promote and we have printed cards and distribute among medical students. In the first day of the medical college, they, along with the parents, they sit for a interactive session. We distributed this card. It is okay to ask for help. And any problem, you can contact this number. And in school, as part of the ICMR project, also in schools, we distribute the card. This is a small card. And there is you can scan and get all the well-being resources available online, including that movie is available. So to summarize, we initially started with the ICMR project, priority project. And it's a research, implementation research, and how the solution principles can be introduced or incorporated into that core action points of the research project, and the frames approach, summarizing the major concepts into that frame and using in training gatekeepers, peer mentors for supporting students going through the problem. And again, safety assessment using the solution in the crisis situation, safety assessment, post-prevention, post-traumatic growth, we can use the solution content. And to prevent you, the entire community, entire school, we have to encourage the well-being through NEST as an acronym. So this is the possibility of solution-focused content to prevent suicide intervention in schools and colleges. So we can ask questions and discuss.
Stop share. Shall we stop sharing?
Any comments?
Actually, there was a question, rather a technical question, about whether they can get these valuable PowerPoint slides from you, if you can upload it somewhere or send it to the organizers, or whether they can access it anywhere.
I think last time also everything will be there in the website. Italian, I think the organizers will do that.
Okay, good.
Yeah.
If we receive it from you, then it comes on the detailed Padlet into your column, where the description of the session also is. So thank you for that.
We'll be happy to share the other material also.
And the movie and other things are available in the website of the ICMR, Suicide Prevention. Behind the Smile.
This is the English subtitle, and only few words are there.
It's available in the YouTube as well. Behind that smile, I'll share the link.
That's great. So some reflections, colleagues, on what you heard. Okay, then I jump in because I'm very impressed by how systematic you think and find these links to the bigger system as the country functions, and I think that that's a very important moment in the whole thing, that you create an impact by addressing it at a good level. So how do you do that?
Actually, for last 10 or 15 years, we have been working with schools and colleges, and also we are working the government system. So we are working with the education department, health department in various school mental health program, and other programs with the health department, suicide prevention program, and community intervention. So now that way, existing systems, they are receptive to introduce that. And the major concern deficit is counseling skills and how to address there's a child or an adult with a depression, how to address in the primary care. there comes the importance of solution focus, which is brief and easy to understand, and a common person can easily, that transferring the skills to non-mental health professionals. So that is the beauty of solution focused concept. So that way it is very handy, and it is easy to understand for them. So it is easy for us to train people and trainers also to transfer the skills, and that give more happiness in that confidence in that community level HR, health workers, school counselors, and even teachers, and even to parents. Uh, how to talk to your child instead of blaming problems, looking for solutions, trying them, supporting the child, reinforcing positive things. So that way, it is a good way of good tool to introduce.
Okay, and the other thing that strikes me is you call it also as a tool, and well, I would even call it toolifying. So you create from these ideas, these acronyms were so clear we could guess it, and I recognized myself how it creates a connection to the idea, how you put it into these words. So I think that also helps to bring it to the people.
And we are currently in the process of publishing it, the concepts. So far we have been doing, and we are trying to that concepts of frame and the nest. We are trying to write a paper and publish, so that it will be peer reviewed and will be used by others.
Great.
Anything else?
I like the concept of post-traumatic growth.
Thank you. I use again that acronym: no sad emotions, no for no impulsive behavior, S for self-care, A for continue activities which give pleasure, and D for design a new life. And emotions means accept the emotion. So after a breakup or stress, emotions, sadness, crying, everything is normal. But accept that emotions and design a new life. So these are useful for teaching our students. Basically, we are teachers. So using acronyms, we can convey these messages easily. And to design a new life and to continue that daily activities, self-care, we encourage NEST. So connecting all these things, we can discuss for a patient sitting in front of us in a clinic, in the ward following a suicide attempt. We can use it. A solution focused technique.
In a trainer's training, like for example, he said no sad emotions, because we all deal with how to the steps for managing PTSD, post traumatic. But then there's a growth that comes up, which really focuses on it. And the acronym, no sad emotions. Will you repeat the?
Yeah, no means no impulsive behavior. S for self-care. A for activities, continue activities which give pleasure. D for design a new life. Emotions means accept the emotions. These are normalize the emotions, sadness or anger, even anger for breakup. Following a breakup, there may be anger. So accept that, and then not act on that. No impulsive behavior for a substance or suicide attempt or self-harm. So for adolescents, they will understand, especially educated. For medical students, we have used it many times, and when they recovered, one medical student during the training program, I be trained when they become intern and attempted suicide. She recollected previously we discussed, and she could come out using that techniques. So these are practical tips we can use in the daily practice hours.
Thank you very much. It was very with a lot of information. So I'm still processing all the ideas that I got from it. And if there are no more questions, I will stop the recording.